Hey, my chosen topic is topic 1. I did research on methylphenidate, or more commonly sold under the brand name Ritalin, and its effect on children, specifically on their working memory. In this presentation, I aim to talk about the effects of methylphenidate on children diagnosed with ADHD and whether or not it affects their working memory. But to begin, I want to clarify key terms I'll be using throughout the presentation. Let's start off with ADHD. What actually is ADHD? ADHD, otherwise known as attention deficit or hyperactive disorder, is one of the more common neurodevelopmental disorders and is often found to be much more common in children. It is usually first diagnosed in childhood and often lasts much later in adulthood. It is often characterized by traits such as being unable to sit still, constant fidgeting, being unable to concentrate on tasks, impulsiveness, and much more. As the traits are often seen to be not very favorable, ADHD sometimes has a negative connotation and can sometimes be considered a disability. Thus, medications such as methylphenidate, or more commonly sold under the brand name Ritalin, is often prescribed to these diagnosed with ADHD. So, what actually is methylphenidate? It's a central nervous system stimulant, meaning it affects chemicals in the brain and nerves that contribute to hyperactivity and impulse control, thus making it effective in treating the symptoms commonly expressed in individuals with ADHD. My first source is a research report straight out of the Journal of Child Psychology and Psychiatry, Volume 48, Issue 9. This experiment aimed to investigate the effects of methylphenidate on components of working memory in attention deficit hyperactive disorder and determine the responsiveness of working memory measures to methylphenidate. This experiment had a sample size of 50 children and adolescents clinically diagnosed with ADHD from ages 6 to 16. Working memory in these individuals were tested in four main categories, which varied in processing demands and modality. The results of the experiment conducted showed that methylphenidate improved the ability to store visual spatial information irrespective of instrument used, but had no effect on the storage of auditory verbal information. However, on the other hand, methylphenidate enhanced the ability to manipulate both auditory verbal and visual spatial information, although effects result sorry, although effects were instrument specific in both cases. The results of this experiment support the idea that methylphenidate does in fact have an effect on working memory in children diagnosed with ADHD. The table shows the means and standard deviations for performance on each of the working memory measures across methylphenidate dose for the entire sample. My second source is a meta-analysis from the journal Clinical Psychology Review. The meta-analysis was focused on the efficacy of methylphenidate, psychosocial treatments, and their combination in school-aged children with ADHD. The results concluded that both methylphenidate and psychosocial treatments were effective in reducing ADHD symptoms. However, psychosocial treatments yielded smaller effects than the effects yielded by the use of methylphenidate in the age range of children from 6 to 12. The results also show that in combination, psychosocial treatments has no additional value to methylphenidate for the reduction of ADHD symptoms. This table shows the number of studies, total number of participants, total weighted mean effect sizes, confidence intervals, and some other stuff as well. The result of this meta-analysis again supports the idea that methylphenidate does in fact have an effect on working memory in children diagnosed with ADHD. Although methylphenidate often is considered one of the first treatments for ADHD due to its efficacy, my third source shows that unfortunately this medication is only effective for some children with ADHD. This is as genetic factors may contribute to individual differences of the efficacy of drug therapy. In this meta-analysis, it is highlighted that pharmacologic studies prove that dopamine and norepinephrine are involved in ADHD symptoms. Thus, methylphenidate is commonly used as a psychostimulant for the treatment of ADHD, and it is often effective at it as it blocks the dopamine and norepinephrine transporter and causes synaptic concentration of those neurotransmitters to increase. However, as previously mentioned, approximately one-third of patients do not respond adequately to stimulant treatment. This meta-analysis aims to understand the difference in effect of methylphenidate between individuals with different levels of hormones, specifically dopamine and norepinephrine. The results concluded that there was a direct correlation between the presence of certain gene polymorphisms and the impact of methylphenidate response. This table shows the results of different gene polymorphisms and side effects of methylphenidate. There are a variety of pros and cons in each of the chosen sources. Both source 2 and 3 were meta-analyses, thus both having an extensive list of reliable sources, having the overall report be much more reliable. The reliability of the first source can be questioned as a sample size of 50 can be considered too small to produce results that comprehensively support the aim. All three sources were acquired via renowned scientific sources, thus making them fairly reliable overall. Although source 1 and 2 show a clear correlation between methylphenidate usage and ADHD symptom reduction, source 3 counters this by showing results that support the argument that methylphenidate is not effective in treatment in all patients. In conclusion, although sources 1 and 2 show a clear correlation between methylphenidate usage and ADHD symptom reduction, along with the improvement in working memory and thus making it a good treatment for children diagnosed with ADHD, it can also be debated that methylphenidate is not a miracle drug for the disorder and will not work on all individuals. Thank you.